when they approached me about being involved in the project and they talked about it, for us it was just another good opportunity to develop some great tools in our repertoire. Professional development was going to be huge for us, and the fact that we were going to be able to use these resources to help our patients. We felt initially that we were doing a lot of communicating and interacting with our customers anyway, but this was going to give us those steps that could add more value, really, and just, it's all about building relationships, and I could see that the project was really going to, benefit in the fact that we were going to learn more about building those relationships and communication. So as far as how it fitted into what we were already doing, so we were doing lots of step 2. So we were giving out health information, we were telling people a lot of stuff. But with doing the training and learning the new resources, we realised we actually did have to find out what they knew before we just embarked on telling them a whole lot of stuff. So by finding that out, it really narrowed the focus on what you needed to add on, so you could really work hard on, rather than giving them 10 things and saying see you later, we could say, okay, you already know that, that's great, these are a couple of more things that we could really let you know about. And then with the step 3, which we all did find to be the hardest step, it was just in some instances where you really could see they hadn't quite got it. You could use the tools again that Workbase and the Commission had developed to give those lines and say, well, I know I've given you a lot of information, can you tell me a couple of things that have really sunk in? Well, generally with surprises, it came from assumptions that I had made. So from the training, I guess we were making assumptions by looking at someone at how much they would already know, and so the surprises were that for people that we felt we didn't need to engage with too much, actually didn't know a lot. Surprises with the staff and the team, the ones that were the quieter ones, the very considered in their approach to counselling, just loved the structure of the project. They loved having those phrases to use. It just gave them confidence. And it was just, those were the surprises for me, that some of my staff I didn't expect to go well with it. Blew me away. So as far as it meeting our expectations, definitely with professional development it's been amazing. The staff all got behind it, and some, the ones I thought maybe wouldn't, really surprised me that they, just took it and ran with it. And we did meet those expectations, and as far as that we all learnt something, we all added on to what we already were doing, and develop those skills. As far as the patients go, I really think that it did build more relationships, and we could use the tools in a small way or a large way depending on what was required. So as far as the next steps go for us, we're certainly not going back. I feel like we've created new habits, and we've seen the results. We've seen how it improves our relationship building and communication with our customers. As pharmacists, we often like to give lots of information, and you really have to pause and wait for people to talk back, and then you can move from there. So it's, I think just dive into it and really, go with it. It's fabulous.